Welcome, everyone, and thank you for joining our webinar today on the digital divide during COVID-19. My name is Suzanne Walker, and I'm the Senior Marketing Manager for Public Health at Jones & Bartlett Learning. We are extremely fortunate today to have an author and speaker that has a great deal of expertise in the area. Let me introduce you. Dr. Patti Rose is president and founder of Rose Consulting in Miami, Florida. She earned her master's degree in health service administration from Yale University School of Public Health, followed by her doctorate in health education from Columbia University Teachers College. As I mentioned earlier, she is president and founder of Rose Consulting, through which she offers speaking engagements, workshops, and consultation in the U.S. and abroad. She is also author of 2 books for Jones & Bartlett Learning. Those titles include Health Equity, Diversity, and Inclusion, which came out in a new edition earlier this year, and Cultural Competency for the Health Professions. And with that, I'd like to turn the presentation over to Dr. Patti Rose. Patti?
Hello, everyone. It is an absolute pleasure to speak with each of you today on this very important topic, which I'm going to get right into, and I'm looking forward to answering any questions that I can after this is over. So thank you again. Let me begin with the question, what is the digital divide? We're going to define it and put it in context so that all of this makes sense as we explore some of the particular issues related to the topic. The digital divide is the gap between people who have sufficient knowledge and access to technology and those who do not. According to the Secretary General of the United Nations, Antonio Guterres, regarding the digital divide, it is threatening to become the new face of inequality, reinforcing the social and economic disadvantages. He further states, we are only beginning to understand the social implications of a post-COVID-19 world. But one thing is certain, as we recover and rebuild, digital technology will be more prominent and important than ever. Those without access will be left further behind. So here I have a diagram in which I will explain digital divide from a visual vantage point. Now remember, I'm only speaking of the United States, so there are some references in this graphic to international scenarios, but I'm going to focus on the US. So let's begin with social. Some of the issues are literacy skills, disability versus fit, and age, old versus young. So of course, if a person does not have literacy skills, it makes it difficult to use some of the technological methods. And the same is the case with some disabilities. And the elderly, I'm going to speak about the elderly specifically because there can be problems when they are trying to navigate the technological world. Family background, including income and education, also come into play. So the less income a person has, the problem can arise that they cannot afford the technology that they need. Ethnicity and language can also be an issue, such as non-English speaking individuals. It brings to mind, I just want to pause here and give an example. For the past 7 years, I taught at a university or various universities in China. And I remember entering the classroom where I would have to face a computer in which everything was in Chinese. And so clearly I understood right there that this is going to be a challenge for me. And luckily, I had a teaching assistant who was Chinese at all times in the room with me to help me navigate the system until I was able to learn some of the Chinese language myself and be able to read and so forth, which literally took years. So that gives us a sense of what we are looking at when we look at a screen and it's not in the language that we speak or read in our primary language. Economics, poverty, as I mentioned previously, unaffordability of technology. And then geographical, rural areas versus suburban areas. So the problem in rural communities is oftentimes there might not be sufficient access to broadband. And there also might be poverty as well in the rural areas. And there's even some problems with the digital divide in suburban areas as well, depending on the type of broadband access that is available in the community. Approach. There is fear of technology for some individuals, and these individuals are often referred to as technophobes. Some people just don't like technology, or they are fearful of it when they attempt to use it. And lastly is lack of motivation or objective, especially now since the lockdown has been for a considerable period of time. A lot of people are beginning to experience what is known as technology burnout. People just don't want to even look at a screen. So let's talk about broadband, our next area of concern, and very, very important. According to Gisela Moya in a Newsday piece, unsurprisingly, the digital divide mirrors economic and racial ones. Last year, a Pew Research survey found distinct patterns in who lacks internet access at home. While 92% of families with a household income of $75,000 or more have a home broadband connection, that figure drops to 56% for incomes of $30,000 and below. While 79% of white households have a home internet connection, just 66% of Black households and 61% of Latino households do. In a 2019 report from the Federal Communications Commission, the FCC, around 21 million people in America don't have access to broadband at home. However, this might be a conservative count. For example, Microsoft estimated 162.8 million people in the US aren't accessing broadband speeds at home. So here we see a pie chart. We're going to talk about Medicare beneficiaries. According to the Healthcare Economist in a paper by Roberts and Marotta, published by JAMA in Telemedicine in 2020, using data from the 2018 American Community Survey, we can see a visual of what is happening. So if you look, you will see that in terms of full digital access, we're looking at about 44%. No desktop and or laptop, 15.1%. No smartphone, 14.6%. And no digital access, 26.3%. So those numbers give us a very clear idea of what is happening with Medicare beneficiaries, which would be the elderly based on that study. As discussed in my book, because now we want to take a look at healthcare specific issues, my book is entitled Health Equity, Diversity, and Inclusion. The digital divide is extremely problematic for individuals in low-income communities. Many people in the greatest need of healthcare do not have access to computers. It is not just about having access to computers, but also understanding the processes involved in visiting a website. It can be complicated for individuals who are not familiar with technology. As I mentioned previously, there are also language and literacy barriers. Having a cell phone is not sufficient because generally they allow very limited access to the internet. The smartphone, therefore, is not enough. Millions of Americans can access the internet only through smartphones. That's better than nothing, but plagued by serious limitations. Data caps and slower speeds greatly limit what users can do. There are difficult tasks that go well beyond smartphone use, including completing forms, accessing health information, health insurance details, and etc. A very concrete example of the challenges is something that occurred here in the county that I live in, which is Miami-Dade County. It's not health related, but it has to do with the K through 12 system. There was the implementation of a new system in which all the kids and the teachers were going to get on at the beginning of the school year and start working technologically. Unfortunately, at the start, it was a dismal failure. There were so many problems related to the digital divide that I can't actually go through all of it here, but I implore you to look it up so you can take a look at what happened, because it's a concrete example of absolutely what can go wrong. And many students that are in the lower income communities did not have access to technology. If they do have access to technology, they may not have access to broadband and etc. And as I said, the smartphone would not be enough. And so many schools have had to provide computers to children that they can use, as well as to the teachers, and they're not familiar with the new systems. It can be absolute chaos. So we really want to keep that in mind when we think about healthcare. Let's look at telemedicine, therefore. Advertisements for telemedicine often arrive in mailboxes from health insurance companies, community health centers, and etc., and state words to the following effect: see the doctor from the safety and comfort of your own home. Health entities tout easiness, affordability, compassion, quality, and that is for the whole family. Further claims are indicated, such as all you need is a phone or computer, covered by most insurance entities, including Medicaid, Medicare, and private insurance. This is seemingly useful. However, what happens to the individuals who do not have computers, as audio-only visits might be inadequate in some situations, such as when visual monitoring or diagnosis is important for care, as indicated by Grisby and Sanders per the Annals of Internal Medicine. It's a very good question. What happens? Additionally, for people who have older computers and want to participate in telemedicine, they must have a microphone to communicate with their provider. What happens if that is not available? This is a looming crisis, and so I want to go over the key factors. Some I have already touched upon, and the individuals and communities relevant to the digital divide, so we can really hone in on who this is impacting. Lack of technical hardware, computers, higher level smartphones, microphones for older computers, tablets, and etc. Lack of Wi-Fi broadband. Geographic isolation. For example, rural communities, as I discussed per the prior diagram. Socio-cultural, socio-economic barriers, affordability. So those are the key factors. Some of them, remember, I'm only giving examples, but there are other relevant key factors. Key individuals and/or communities, low-income communities, the elderly, racial and/or ethnic emerging majorities with low income. Now, I stress with low income because it would be inappropriate for us to consider that a racial and/or ethnic emerging majority person is a person who has problems in terms of the digital divide just because of race and ethnicity. It is not that. It is because of low income. And so we want to really keep that in mind, because with income, the problem in terms of the digital divide can be resolved. The need for digital empathy. Now, this concept of digital empathy is extremely important. As society moves towards online approaches in terms of healthcare and beyond, technological communication modalities must be empathetic in terms of compassion, cognition, and emotion. Think of it like bedside matter, but technological bedside matter. Specifically, per Terry and Kane in the American Journal of Pharmacy Education, digital communications are devoid of many of the emotional signals and cues experienced in face-to-face settings, often leading to more impersonal interactions. These changes in modern technology present challenges to the evolving socio-communicative aspects of healthcare and require an understanding of the emerging construct of digital empathy. They offer a definition of digital empathy as the traditional empathic characteristics, such as concern and caring for others, expressed through computer-mediated communications. So that is extremely important. Giving another example, a few nights ago, I had a Zoom session with students from an historically Black college, university, I should say. And I had a lot of participants, and I could see some of them because they were live and I could look at them and see their movements and so forth. Others just had their names across the screen. Others were visible to me through a still photo, and I was visible to all of them. With that being said, we were talking about an extremely important topic, and it was kind of difficult for me to connect with those that I could not see. It was difficult for me to reach them in the same way that I could reach the individuals that I could see who were on live. And so when we are dealing with individuals who need our help, and we're doing so technologically, we have to take into consideration that when we are with them one-on-one and we can see them and they can see us, there has to be empathy in the process. And sometimes that is missing technologically, depending on what we're using. Also, we want to consider visual background shame. And this is an example that should be associated with digital empathy. Sometimes, even when individuals have access to computers and have been able to access the necessary hardware to participate in telemedicine, they may be ashamed of their homes, and that health providers can see how they live through the visual medium, especially if they are poor and their environment is reflective of their socioeconomic status. This must be taken into consideration, as it may prevent individuals from participating in medical sessions. Healthcare providers using telemedicine must understand and have insight regarding their patients. Healthcare providers must not view their patients as avatars, but as human beings with lives and realities beyond their health issues, and show empathy and compassion at all times. Simple steps, such as making direct eye contact with the patients via the screen, as an example, is imperative. I want to talk about some potential solutions and emphasize that these are only examples, as I'm hoping that this will stimulate others to come up with solutions beyond what we are discussing today. The first is donations of high-level computers to individuals in low-income communities, for example, from Apple, Microsoft, etc. Now, this is happening on some levels. And also, individuals are donating computers. For example, you have a computer, you get a new one, and then you look at the older computer and you say, where and how can I donate this? This is laudable, and I'm sure that people appreciate it, but we have to take into consideration if the computer that we are donating is outdated and does not have some of the accoutrements that are necessary for people to be able to use them for telemedicine and et cetera, we might want to reevaluate exactly how we proceed with our donation. We also want to consider how can broadband access be expanded. Again, this can be done through companies, this can be done through healthcare organizations, and et cetera. And it is being done. Going back to the school systems, we can find that some school systems are actually working with companies to expand broadband access in lower income communities so that children can participate in technological schooling. We have to consider this also for healthcare. Digital empathy, I already went over that, but perhaps the consideration of courses to be taught to healthcare providers and books written around this topic of digital empathy, so it can be taught as a skill to healthcare providers, because this is going to be something that we may have to deal with for quite some time. So given that, we might as well develop this skill set. Community health workers with technological skills to assist with telemedicine. As one who has served as a president and vice president of community health centers that are usually located in lower income communities, one of the steps that we would take would be to send out community health workers into the community with information, pamphlets, books, etc., educating the patients around what they needed to know. And in this case, we might want to think of getting health workers to go into the community who also have technological skills. These individuals can actually go into the homes of the elderly who are trying to use technological telemedicine and those kind of things. And given COVID-19, of course, that's quite challenging. But if we can parallel it with what's happening in homes of children who are being educated, pods are being formed, people are being brought in who are socially distancing and following all of the required CDC protocols and so forth, but assisting the children in the homes, especially in those situations when the parents can't do it. So this might be something to consider to do in the homes of individuals who need help with telemedicine, just as an idea. Per my book, Health Equity, Diversity, and Inclusion, I also discuss some techniques or solutions that we can consider, because this is a puzzle that has to be put together. Now, I wrote this before COVID-19, so to me, what this says is that these are not necessarily new issues, but we just simply need to modify and enhance what we have already been thinking about as solutions to deal with disparities. Innovative approaches to facilitate the sharing of health information must be developed, including the use of print sources, taking literacy levels and cultural and language proficiency into consideration. So we don't want to get away from the printed medium because we're using technology. And so we can still do that, and we can talk about that a little bit more in the discussion and question and answer phase of this. Broadcast media, including radio and television, and one-on-one discussions with patients must be included in the mix of the solutions. So again, this is a puzzle with many, many pieces, and we have to try to bring it all together as we move towards solutions. Prioritization is necessary in order to close the digital divide. So for the low-income, emerging majorities and poor communities, they must be prioritized, because these are the communities that are hit the hardest with the digital divide, along with other marginalized communities, people without computer access, the elderly, and rural communities. So in closing, what I want to say is that the digital divide must end. The bottom line is that the digital divide existed before COVID-19, during it, and will continue afterwards if efforts are not made to resolve the issue now. Potential solutions have been discussed in this webinar, but other ideas towards resolving the problem should be explored and considered. Ensuring that all individuals in a society which is functioning in a technologically focused reality have optimal digital access and skill sets and/or technological assistance is imperative. If there are any questions, I hope that you will proceed with them, and I will answer what I can. And thank you so much for this opportunity to speak with you today.
So if anyone has any questions, just a reminder to type them in the question box on the right-hand side of your screen. If anyone wants to offer up any potential solutions to helping to close the digital divide, to share that with the group, that would also be welcome, or comments to today's presentation. All right, here is a question. How do you see the role of apps? This is from Luz Claudio. I don't know, how do you see the role of apps if you feel like that's enough to respond to?
Yes, I think apps can be very useful. As I did discuss the smartphone, And I think that if individuals had access to apps on their phone, whether it be for information purposes or even perhaps for telemedicine, I'm not sure what exists already in terms of apps, but I think it would be a novel idea because many people, as I discussed, that do not have access to computers per se, either a laptop or a desktop, etc., may have a smartphone. And so apps can be useful depending on how they are created, taking all that I have discussed into consideration, literacy levels, language barriers, and all of those factors. But I think it would be a very excellent and novel idea. And I'm sure that there must be some in existence already.
Okay. I appreciate the use of print materials with the concern of COVID-19. Any suggestions to alleviate this concern?
Yes, well, it's a difficult task. As I mentioned, the community health centers and health insurance companies and et cetera, if you notice, they are sending mailings on a regular basis. In fact, the information that I provided regarding the telemedicine advertisement, in which I shared some detail from, that came through my mailbox. I didn't put it up as an example because it was a specific organization, but we can use the mail through healthcare facilities to send individuals information, as well as brochures and those kinds of things. So the mail is still flowing. So even though individuals might not be coming to the facilities, I think it would be useful to mail things out. And in that way, you can ensure that they are culturally competent, that they are taking into consideration language proficiency, as well as reading levels and all of those kind of things. So I don't think we should get away from the printed word because I think people will see those items in their boxes and possibly read them, and they can be targeted. So if we know that patients are having a specific problem and they need very specific information, mailings that are sent out to them can be targeted to their needs. So I think that's still very useful.
Okay, we have another question here. Do you think libraries could help with computer access?
Well, libraries have been very helpful throughout the digital divide, even before COVID-19, with computer access. The problem now, and it depends on what city you're in, what the situations are, and so forth, libraries have been closed, and so people haven't been able to access libraries. But yes, libraries have been very useful in terms of technology, and you often can get assistance if you don't know how to do things, because literally sometimes people don't even know how to turn the computer on, and if they know how to turn it on, they don't know how to go to a website and things to that effect. So libraries are excellent because you have the opportunity to have people right there who can assist. The problem is that right now libraries aren't opened, or sometimes they're not allowing computer usage and so forth. So during COVID-19, it's a little bit of a challenge, but moving forward, it is definitely something to consider.
I have a comment here, which I think is helpful on access. During COVID-19 stay-at-home orders in Idaho, Idaho State University extended broadband to university parking lots at the main and satellite campuses. This was helpful for the students who lived or remained in those local areas. Also, programs were established to provide computers if needed.
Well, I think that's outstanding. And I mentioned something similar to that during the webinar discussion, and that is entities can help with this. And it's really excellent for students. The only time it becomes a problem is when you have a person who is sick. And so the person who is sick, it's kind of difficult, or it could be difficult for them to go in their car and find a location that has Wi-Fi and sit there and then try to access. So with healthcare organizations, we have to take that into consideration for those people who are homebound and they're not able to do that. But otherwise, I think it's a fantastic idea, and I really appreciate your sharing that. There was a recent news story about two young girls. I won't go into it in detail, but they were using the Wi-Fi outside of a Taco Bell in order to do their schoolwork because they just didn't have Wi-Fi. And there was a real issue that ensued around that. So if you have an opportunity, you might want to take a look at that and see what happened.
Thank you. Here's another question. Can you please touch on policies supported by internet companies to prevent localities and other groups from starting their own broadband service? What happened to economy? We now have to depend on broadband companies to solve problems they help create.
Well, I think that that's a very complicated question, and I don't necessarily have the answer to those questions because what is happening with technological companies and broadband and so forth is something that, from a health vantage point, we need to get together, explore, read about it, and then become advocates around it. So I'm a health advocate in terms of disparities, equity, diversity, inclusion, all of these things. So I'm absolutely willing and open to understand what the shortcomings are in terms of broadband companies and then communicating with them to ensure that they're dealing with these issues. But unfortunately, I'm not aware of the specifics of what you're asking, so I won't endeavor to answer that.
Okay. Here's another question, sort of comment. I always thought a TV channel might be a way to provide educational materials, and possibly a medical channel.
I think that's fantastic. And I also believe that I mentioned that, and I do talk about that in my book, because the way that that has been happening has been through medical talk shows with an audience and so on and so forth. And I think that although that might be enjoyable for some people, I'm not sure if that's what we're speaking about. I think a dedicated channel to providing health information to individuals on various topics, in the same way that we utilize brochures and pamphlets and booklets and so forth with experts and scientists and et cetera, would be very useful. And perhaps it could be interactive for those individuals who can access social media. They can tweet in questions and so on and so forth. These kinds of things are done with all kinds of other entertainment venues. I think we can also do that with health, but it would have to be thought through and put together in such a way that it addresses people that have the greatest needs. And those would be the priority individuals that I mentioned, or the priority groups that I mentioned in the discussion. That would be my perspective on that.
All right, here's another question. What do you think about physicians' offices offering educational sessions for patients who may be interested in telemedicine but do not know how to use the technology?
I love that idea because I think that individuals, even during COVID-19, are going to their physician's offices. And, you know, we have all this time when you go to a physician's office where you're sitting in the waiting room. And so this time can be utilized instead of just having patients sit and staring at a wall or reading magazines. It would be so wonderful if there were computers set up and maybe a staff person who's instructive to teach people how to do certain things specific to telemedicine. Now that's a creative idea that I think is fantastic. And I don't know if it's being done. Again, sometimes we think we're creating an idea and it's already out there, but if it's not being done, it's fantastic. It should be done. If it is being done, it should be done more, because that's fantastic.
Here's a question along the same lines. Do you see large corporations, hospital, local government systems assisting with the outreach of telehealth and decreasing the digital divide, especially among the at-risk populations you've identified?
Yes, I think that any and all entities that can get involved in this process, as long as they are doing it correctly, I think that would be really helpful and very useful, because we spend a lot of time in different places and we do a lot of waiting. And it would be excellent if that time can be used in this way to continually educate individuals around health issues. My only concern is making sure that it doesn't become some kind of profit venture in which people are not getting accurate information and things are not thought through and carefully done, and that we are getting this done with the people who need it most. And that's the challenge, because this has to be done in communities where people don't have access. And oftentimes we find things that are needed in communities where people already have it. So we really would have to target it to the priority areas. But once again, I think that's a fantastic idea.
How do you address students in a college course who have challenges related to having to share one laptop with younger siblings and limited cell phone capabilities?
It's quite a challenge. This would be part of the digital divide, I would say, because if there's only one computer and there's multiple individuals, that's a challenge. And so there has to be some kind of sharing system in that situation. The smartphone is not necessarily the solution, because for more complex things that you have to do, the smartphones will not work. This is a case when we use these kinds of examples where we need to approach Microsoft, Apple, and some of these big companies. There's so many others. I'm only using those companies as an example to see if donations can be done. Because just as scholarships are provided for education to pay for tuition and so forth, perhaps there needs to be scholarships specifically targeted toward technology, where students can apply and be accepted to receive a laptop or an iPad. And I really don't want to advocate the iPads too much, even though they're wonderful. But at the same time, we need to be able to use the desktop or the laptop computer for some of these more complicated scenarios, even though you can get a keyboard for your iPad and enhance it. But that's another story. So the bottom line is that we need to have donations and computers made available to everyone who needs it in this society. And that has to be one of our greatest steps, particularly in terms of healthcare and in terms of education. It's imperative.
Okay, I'm going to do a few more questions. How do you suggest contacting large entities to make changes such as providing computers and phones? I worked with a nonprofit clinic that is currently struggling to provide care through WhatsApp.
Well, I think, again, what I understand is that companies are being contacted by organizations and letting them know what their issue or concern is, and then requesting help. So, for example, a community health center might have someone from their executive team contact one of the larger computer-oriented companies and let them know what their situation is and see if they have any availability to assist. Utilizing WhatsApp and some of the other apps, so I would say, because WhatsApp is an app, using some of those. We have to be very mindful because health information requires a great deal of confidentiality. And so we want to be very careful about where the information associated with people's private medical concerns is actually being stored. So I think this is very complicated, and unfortunately, in the short time that we have, it's difficult to go through it. But you need technological expertise, and we need to be speaking company to company to figure out exactly what we're doing to make sure that if we're doing things with particular apps, with companies and so forth, that we're making sure that confidentiality around healthcare issues is at the forefront. So it's complicated, but I think that communication is the best way. Healthcare entity to larger corporations who are technologically oriented and who can help, and then weeding out all the potential problems before moving forward.
Okay, here's another question. Thoughts about working with affordable housing to include more broadband internet in community center or housing projects?
I think that's a fantastic idea because it needs to happen in lower income communities. And so how that would happen is, again, probably complicated because we're talking about money being available for this to be achieved. And so there's no reason why there can't be dialogue and discussion around this, because perhaps there is money to make this happen, and particularly targeting those individuals who need it. So if we begin with the elderly, I think that is very important, because oftentimes in housing projects, you have elderly people in those environments, oftentimes living alone, oftentimes needing healthcare and so forth. And if that is the case, then perhaps starting there, just ensuring that the argument is that we need broadband enhanced in low-income housing for the elderly. We need it for the children who are in K through 12, who are trying to learn during lockdown, and just making a very cogent argument around this. And of course, finding out if there are funds available, but more importantly, to see if the housing projects, HUD, et cetera, can work with some of the corporations that provide broadband to do so for the communities in which perhaps money might not be as much of an issue as we think it is. So yes, I think it's a fantastic idea. I love these ideas as they're emerging from our discussion. They're just fantastic.
You know, it's interesting you just said that. Mary Fortier just made the comment that COVID-19 has major corporations downsizing and not so forthright in their donations. Economic impact is often felt at the level of our most needy populations.
Agreed. Agreed. That is a very unfortunate situation. But at the same time, what we would be asking for, I believe, is prioritization of your donations. Just, I'm the one that doesn't take no for an answer very well. And so I understand that donations are down, but what are you donating to with what you have? And so given that this is so important, perhaps there are donations that can be reprioritized that perhaps are important, but maybe not as important as this. And so everyone has to make their case. So the fact that donations are down is not a no. It just means, can we reprioritize them? Because this is really important. So that's how I would approach it.
Well, I think that does it for the questions today. I'd like to thank everyone for joining us and sticking around to listen to Patti's responses to all of these very interesting questions and listening to her insightful presentation today. On the screen, you'll see Dr. Rose's latest book, which she referenced during today's presentation. If you have any questions or comments you'd like to share, please email me, Suzanne Walker at swalker@jblearning.com. And on behalf of Dr. Rose and myself, we hope you stay healthy and safe and have a great day. This ends today's webinar. Thanks, everyone.